Post-procedure patient care. Wound assessment. Pressure is applied immediately after the biopsy or localization device is removed from the breast. Pressure is maintained for 10 minutes. The skin is cleaned, removing the betadine solution, and Steri-strips are placed once no further bleeding is observed. A disposable ice pack is placed inside the patient's bra with a 4x4 padding to maintain pressure. Discharge instructions. Ice pack for 1 hour, then 10 minutes an hour until bedtime. Take Tylenol as needed for pain. No aspirin or ibuprofen for 2 days. No blood thinners for 4 days. No strenuous activity for 2 days. Do not shower or bathe until the next day. Let the Steri-strip come off on its own with bathing. If bleeding occurs at the site, apply firm pressure for 10 minutes. The patient is told that we will call them the next day. The patient is told that the pathology results should be available within 2 business days and that we will notify her referring physician as soon as we get them. We give them our contact phone numbers and tell them to feel free to call us directly if they have not heard pathology results after the 2 business days. Post-biopsy mammogram. The patient is taken for her post-biopsy mammogram and observed to assure that this does not begin any bleeding from the wound. Post-procedure phone call. The patient is called the next day to evaluate for any post-procedure complications. Pathology follow-up. Documentation. Once the pathology results are obtained, they are faxed to the referring physician's office, and then the office is called to confirm receipt of the fax. The time of the faxing and the time of the individual confirming receipt is documented. A folder is then made containing the pathology report, documentation of the referring physician notification, and the original diagnostic MRI report. This is then given to the radiologist. Recommendations. The radiologist will review the pathology, dictating an addendum to biopsy report with any recommendations for follow-up. In most cases of benign pathology results, a follow-up MRI is recommended within 6 months to assure that there has been adequate sampling of the abnormality in question. This interval may be shortened if the lesion was highly suspicious for cancer.